So this is the continuation report of Ms. Asorian. So, prevalence of intellectual disabilities in the Philippines. The estimate of individuals with intellectual disabilities enrolled in special education in government schools in the Philippines for school year 2012-2013 is 12,120. So ang na-enroll sa sa special education atong 2012-2013 is kuan kabuok is 12,120. Etiology. Causes of intellectual disabilities. Intellectual disabilities can have a wide range of etiologies. This could include initial factors, genetic and biological, which an individual has no control of, environment factors, toxin teratogens, which can often be prevented. So, etiology causes of intellectual disabilities, ang main gun gid ana niya is ang katong syndrome tapos teratogens. The table below shows some etiologic risk for a risk factor for intellectual disabilities. So timing, biomedical, social, behavioral, educational. First is prenatal. Biomedical ana niya is chromosomal disorders, single gene disorders, syndromes, metabolic disorders, cerebral dysgenesis, mental illnesses, parental age. Sa social niya is poverty, maternal malnutrition, domestic violence, lack of access to prenatal care, behavioral, parental drug use, parental alcohol use, parental immaturity, educational, parental cognitive disability without support, lack of preparation for parenthood, perinatal is biomedical niya, premature birth injury, neonatal disorders, lack of access to birth care, sa behavioral, parental rejection of caretaking, parental intervention, abandonment of the child. Educational, lack of medical referral for services at discharge. So, third is postnatal. Traumatic, biomedical niya, traumatic brain injury, malnutrition, meningoencephalitis, seizure disorders, degenerative disorders. Social is impaired child, adequate caregiver, lack of stimulation, family poverty, chronic illness in the family, institutionalization, behavioral, child abuse and neglect, domestic violence, indicate safety measures, social deprivation, difficult child behaviors, educational, impaired parenting delay diagnosis, indicate early intervention services, indicate special educational services, indicate family support. Okay. Prenatal condition associated with intellectual disability and their causes. So first, syndrome, definition and cause, remark and characteristic. So first, Down syndrome. Ang Down syndrome is ang definition and cause ana niya is due to chromosomal abnormality having the 3 of the 21 set of chromosomes instead of a pair, often result in moderate level of intellectual disability, although some individual function in mild or save range incidence increase with the age of mother. Remark and characteristics, physical features, short stature, flat, broad, face with small ears and nose, upward slanting eyes, small mouth with short roof, protruding tongue may cause articulation problems, hypotonia, floppy muscles, heart defects. Heart defects are common, susceptibility to air and respiratory infections. Next, fatal alcohol spectrum disorder, FASD. So, ang definition and cause ana niya is incorporates fetal alcohol syndrome, fatal alcohol effect, and alcohol-related neurodevelopmental disorder due to mother's excessive alcohol using during pregnancy. Remarks and characteristics, leading cause of intellectual disability with higher incidence than Down syndrome and cerebral palsy. Aside from cognitive impairments, some children experience sleep disturbances, motor dysfunctions, hyperirritability, aggressions, and conduct problems. Next is fragile and syndrome. A triplet repeat mutation on the X chromosomes interferes with the production of the FMR1 protein, which is essential for normal brain functioning. Males are usually affected while females are usually carriers. Most common inherited cause of intellectual disability and most common clinical type of intellectual disability after Down syndrome. Phenylketonuria, genetically inherited condition in which a child is born without an important enzyme needed to break down an amino acid phenylalanine. By analyzing the concentration of phenylalanine in a newborn's blood plasma, doctors can diagnose PKU and treat it with special diet which helps them have normal intellectual development. Next is Prader-Willi syndrome, caused by deletion of a portion of chromosomes. Infants have hypotonia, fluffy muscle, and may have to be tube feet. Associated with intellectual and learning disabilities, behavior problems are common, such as impulsivity, aggressiveness, temper tantrums, obsessive compulsive behaviors, self-injurious behaviors, such as skin picking, delayed motor skills, short stature, small hands and feet, underdeveloped genitalia. Next is Williams syndrome, caused by deletion of material on 7th chromosome. Cognitive functioning range from normal to moderate levels of intellectual disability. Characteristic elfin-like features and manners of expression exude cheerfulness and happiness. Described as over-friendly, lack of reserve towards strangers, often have uneven skills profiles with strength in vocabulary and storytelling skills and weaknesses in visual spatial skills, often hyperactive and may have low tolerance for frustration or teasing. Range of intellectual disability. Individuals with intellectual disability are classified according to their IQ scores, which could range from 70 plus or minus 5 points of measure error to below 20. Individuals with intellectual disability are classified according to their IQ score, to which could range from 70 plus or minus 5 points of measure error. The characteristic of those with intellectual disability whose IQ scores are within the range vary widely. So, ang range of intellectual disability is matawag siya na intellectual individual with intellectual disability according sa ilahang IQ, which could range 70 or plus or minus nimo siya 5 points of measures error to below 20 individuals. Range of intellectual disabilities. So, nasa severity level, conceptual domain, social domain, practical domain. So, sa ayang severity level is mild pa. So, sa ayang conceptual domain is no obvious conceptual differences for preschool children, for school-age children and adults, difficulties in learning academic skills involving reading, writing, arithmetic, time, or money, with support needed in one or more areas in order to meet age-related expectation. In adults, abstract thinking, executive functioning, and short-term memory, as well as functional use of academic skills, are impaired. Somewhat concrete approach to problems and solutions compared with age mates. So, social domain niya is more immature in social interaction compared to typically developing age mates. Communication, conversation, and language are more concrete or immature than expected for age. Difficulties in regulating emotion and behavior in age appropriate fashion. Difficulties are noticed by peers in social situations. Limited understanding of risk in social situations. Social judgment is immature for age, and the person is at the risk of being manipulated by the others. Practical domain niya is may function age appropriately given personal care, needs some support with complex daily living tasks in comparison to peers. In adulthood, supports typically involve grocery shopping, transportations, home and child care organizing, nutrition, food preparation, and baking and money management. Recreation skills resemble those of age mates, although judgment related to well-being and organized around recreational requirement require support in adulthood. Competitive employment is often seen in jobs that do not emphasize intellectual skills. Generally need support to make healthcare decisions and legal decisions and to learn perform skilled vocation complete, competently. Support is typically needed to raise a family. So next is moderate na siya. Conceptual domain niya is conceptual skills are markedly behind those of person through development. For preschoolers, language and academic skills develop slowly. For school-age children, progress in reading, writing, mathematics, and understanding of time and money occurs slowly across the school years and is markedly limited compared to that of peers. For adults, academic skills development is typically at typically at elementary level and support it's required for all use of academic. So next is mark differences from peers in social and communicative behavior across development. Spoken language is typically a primary tool for social communication but is much less complex than that of peers. So capacity for relationship is evident in ties to family and friends, and the individual may have success friendship across life, and the sometimes romantic relationships in adulthood may not perceive or interpret social cause accurately. So can care for personal needs involving eating, dressings, elimination, and hygiene as an adult, although an extended period of individual to become independent in these areas and reminders may be needed. Participation in all household tasks can be achieved by adulthood through extended period of teaching and support. Independent employment in jobs that require limited conceptual and communication skills can be achieved. Caretakers provide extensive support for problem solving throughout life. Speech and communication are focused on the here and now within everyday events. Language is used for social communication more than for explication. Understand simple speech and gestural communication. Relationship with family members and familiar others are source of pleasures and help. Cannot make responsible decisions regarding one's or others' well-being. In adulthood, participation in tasks at home, recreating, and work requires ongoing support and assistance. Skills acquisition in all domains involves long-term teaching and ongoing support. Mal- maladaptive behavior, including self-injury, is present in a significant minority.